My name is JC Lanningham, and I'm going to be doing my NG skill video. Throughout my entire skill, I'm going to make sure I maintain my GPSP. I'm going to make sure I check and verify the order. I've done all necessary assessments. I'm following my 2 patient identifiers. Can I just get your name and date of birth? That's perfect. I'm checking on the band and it matches. We want to make sure we assess for any allergies. Are you allergic to anything that I need to know about? Nope. Okay, we're good. So now we're going to go ahead and we're going to perform hand hygiene. Put on our gloves. And everything's been set up, like everything is sterile. My sterile field was, it was set up in my sterile field. I want to make sure that I've checked everything and that the expiration's correct. And it's all unopened and dry. Expiration date is good. So now that I've got my gloves, I'm going to go ahead and I need to measure from the nostril to the ear to the xiphoid process. And I'm just going to mark that here with a piece of tape. Okay. During this skill, I want to make sure that my patient isn't in any distress. There's no signs and symptoms showing anything. And I want to make sure that I would stop if it would come down to that. This is my trash. And then now I'm going to go ahead, I'm going to perform my hand hygiene again. I'm going to don clean gloves again. Now I'm just going to lube my tube. And I'm going to go ahead and I want to make sure that I'll give them a drink of water first, and I'm going to advance. I'm going to have them swallow. I'm going to advance while they're swallowing. And I'm going to have them tilt their head back, but I need to feel the pharynx, so I'm going to have them put their head to their chin to their chest and advance. And I'm going to secure this. And make sure not to let go of that too. Got it with this hand. I want to mark it to know this part. Now I'm just going to secure this with my tape. Again, just to make sure. Now I'm going to call for a chest x-ray, and I want to check the gastric content for the color, and I want to check the pH. So I got my pH strips here. Looks good. It's 4. Now I'm going to go ahead and measure from the nostril to the end of the tube. The start of the tube, I guess. And that's perfect. I would document that, make sure I note that. Now I'm going to, I would record that, obviously. Now, per orders, I'm going to attach it to the suction. And I want to put it up here on their shoulder, staying above the stomach. And I would attach that to the pump for an intermediate low suction. And we're keeping it on the shoulder. And then I'm just going to make sure I've checked my patient, I've assessed they're not in any stress, they're tolerating it very well, and I'm just going to report and record. Thank you. Out loud, remove my gloves and perform hygiene and then go report and record.